The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone, and thank you for joining. A warm welcome from Geneva to the World Heart Federation's Advocacy webinar, focusing on upcoming discussions on the 71st World Health Assembly later this month. My name is Alistair White. I'm the Policy and Advocacy Officer at the World Heart Federation, and today I'm joined by my colleagues Pilar and Mihaela from the Communications team and Oana from the Programs team. Just a note to say that we'll include the advocacy team email address on the last slide of this presentation, should any questions occur to you during it. Just to quickly run you through the agenda for today's webinar, we'll start by giving an overview of the World Health Assembly and the main reasons that WHF staff, board members and member partners will be attending. We'll then discuss items on this year's agenda, paying special attention to two of the main items we'll be tracking. These are preparations for the third UN high-level meeting on NCDs and discussions on a resolution on rheumatic fever and rheumatic heart disease. We'll then run you through some of the events taking place alongside this year's World Health Assembly. There are 3 events this year that WHF are involved in or are co-organising. Finally, we'll provide some information on how you can follow the meeting yourself and also briefly look ahead to World No Tobacco Day, which takes place on the 31st of May and this year has the theme of the impact of tobacco on cardiovascular disease. At the bottom of this slide, you can see a link to access the reports and agenda items of this year's World Health Assembly. We will also publish a link to the PDFs of these slides so that you can access these links. So firstly, what is the World Health Assembly? This is the main decision-making and governing body of the World Health Organization. It meets once every year in Geneva in May, and its agenda is largely determined by the WHO Executive Board meeting in January, where member states or governments and organizations such as the World Heart Federation give their perspectives on various topics in global health. Whereas the Executive Board is made up of 34 public health experts from different countries and rotates every few years, all World Health Organization member states meet for the World Health Assembly. Documents submitted for consideration and debate at the World Health Assembly include resolutions, reports, and updates on different health issues. The resolutions and reports are gradually uploaded onto the WHO website as we get closer to the World Health Assembly itself. So why do we attend? Firstly, we aim to keep an eye on the main issues in global health and also aim to influence the discussions that take place. This can be done in several ways. Firstly, by providing an opinion on those issues, which we can do through our own policy statements in the room or organising side events. Alternatively, we can talk directly to decision makers who are attending the World Health Assembly and who convene each year to determine the global health agenda. During the meeting, while we are there, we network and build up contacts with officials and ministries of health and the missions here in Geneva in order to highlight how exactly the World Heart Federation and our member organizations can best help member states to improve their policies and action on cardiovascular disease and NCDs. Moving on to the agenda itself, as usual, there is a packed agenda to fit into just 5 or 6 days of discussions, so we've chosen to highlight the 5 items that we will be following most closely. So to start with item 11.1, the draft 13th General Programme of Work. This is one of the key items on this year's agenda. Once agreed, it will determine the work of WHO for the years 2019 to 2023. And this has been driven in part by the new Director General, Dr. Tedros Adhanom Ghebreyesus. The 3 strategic priorities of this document are universal health coverage, health emergencies, and healthier populations. And previous drafts of this document were discussed at the Executive Board Special Session in November 2017 and at the Executive Board in January 2018, earlier this year. So how does CVD fit into this? CVD comes under NCDs under one of the 5 platforms under healthier populations. And this is titled Accelerating Action on Preventing NCDs and Promoting Mental Health. A separate impact framework which will measure progress in implementing the General Programme of Work, was released on the 5th of March 2018. There are many indicators for measuring global action on NCD and CVD risk factors included in this impact framework. These include the prevalence of tobacco use and raised blood pressure, targets to reduce physical inactivity, population salt intake, and harmful use of alcohol, the elimination of trans fats, and also halting the rise in childhood overweight and obesity. The one area of which we remain concerned is the omission of targets on the provision of essential medicines and technologies for NCDs and drug therapy and counselling, both of which are included in the NCD Global Monitoring Framework. And this is a point we will aim to make in our advocacy at the World Health Assembly. Related to this, another item which we will make a statement on is 11.5, addressing the global shortage of and access to medicines and vaccines. This is a key area for WHF's advocacy, as access to CVD and NCD medicines remains poor for many people around the world. The WHO's report on this item sets out which actions it can currently undertake given available resources and what it could do given additional funding. It also notes that the World Health Organization will develop a roadmap report on improving access to medicines in consultation with governments for consideration at next year's World Health Assembly in 2019. And our key message on this item will be calling on governments to prioritize medicines for circulatory diseases such as CVD, stroke, diabetes, and kidney disease during the development of this report. The next item we would like to highlight is 11.7, preparation for the third high-level meeting on the prevention and control of NCDs in 2018. This will be the third meeting following the first and second, which were held in 2011 and 2014. This represents the halfway point, this third high-level meeting, of the deadline for the goal of reducing the number of premature deaths from NCDs by 25% by the year 2025. And we'll come back to this item more in a couple of slides. Another important topic is agenda item 12.2, physical activity for health. A global action plan for physical activity was originally requested by governments at the Executive Board in January 2017, and then a consultation process was begun in August last year. This draft was released and revised for the January 2018 Executive Board meeting, and a more recent draft has been released in March this year. There haven't been many updates to this report, and the Global Action Plan remains largely as it was, with a target of a 15% relative reduction in physical inactivity among adults and adolescents. There is also now a physical activity indicator in the impact framework of WHO's General Programme of Work for the years 2019 to 2023, which will hopefully contribute to physical activity remaining a public health priority for governments in those years. We hope to deliver a policy statement on this item, which will focus on recommendations for the indicators that will measure the success of the Global Action Plan. We will also urge that governments do not overlook the need to encourage physical activity and active play among children under the age of 11. This is because the two core indicators in the Global Action Plan measure insufficient physical activity among those aged 11 to 17 and 18 and over. And we will be urging governments to promote physical activity among children as part of a multidisciplinary approach. The final item we'd like to highlight on this slide is rheumatic fever and rheumatic heart disease, item 12.8. As you may know, through an initiative WHF co-founded in 2014, RHD Action, we and our partners have been campaigning for a resolution on RHD for the past few years. On 1st of June 2017, at the 141st Executive Board meeting, governments recommended a resolution on rheumatic fever and rheumatic heart disease for adoption at this World Health Assembly. And we'll again come back to this item in more detail in a couple of slides. So moving on to the third UN high-level meeting. A date has now been announced for this meeting. It will be held on the 27th of September 2018. The meeting itself will consist of plenary discussions and panels with an overall theme of scaling up multi-stakeholder and multi-sectoral responses to the prevention and control of NCDs, in the context of the 2030 Agenda for Sustainable Development. This follows the second high-level meeting in 2014, which set 4 time-bound targets to be achieved by 2016. These included the setting of national NCD targets for 2025, developing national multi-sectoral policies, reducing risk factors, and strengthening health systems. Progress towards these has been insufficient and uneven. For example, the NCD Progress Monitor for 2017 noted that only 94 countries, 48% of all WHO member states, had implemented operational multi-sectoral strategies to address NCDs. WHO's report on this item is largely unchanged from the report to the Executive Board in January, which makes a case for urgent action on NCDs. In terms of next steps on the UN high-level meeting process, governments will negotiate the outcome document from this meeting in New York from the months of May to July, making these next 3 months a key window of opportunity to advocate to governments. The World Health Assembly will also present an opportunity to advocate face-to-face. Civil society will have an opportunity to officially give its views on the 5th of July in New York. Organizations, not just those currently in official relations with WHO, can all apply for accreditation to attend this meeting and to present their views until May the 18th. We've included a link on the slides to find out more about this process, and you'll be able to find this link in the PDF versions of this slide. Please contact us via email by the address at the end of this presentation if you have any further questions on this topic. In terms of World Heart Federation's advocacy key messages for the high-level meeting, we will be releasing these as well as some campaign materials by mid-May at the latest. As we mentioned earlier, another key item will be discussions on a resolution on rheumatic fever and RHD, which are likely to take place towards the end of the week. As you can see from the slide, there were around 20 co-sponsors of this resolution when it was submitted in June last year, with New Zealand as the lead government. The title of the resolution has now been expanded from just rheumatic heart disease to rheumatic fever as well as RHD, after a suggestion from the government of Thailand. This was partly to place more emphasis on primary and secondary prevention of RHD as the most effective approaches to tackling these diseases. So what's in the current draft? The resolution itself contains actions and recommendations for 3 different groups. These are member states or countries, the World Health Organization, and relevant international stakeholders. This last list includes NGOs such as the World Heart Federation, academic institutions, philanthropic organizations, and relevant private sector entities such as manufacturers of essential medicines. The updated resolution to be discussed later this month has not yet been released, but we do not anticipate many changes from the version discussed in June last year. So firstly, the resolution calls on member states to take action in 5 areas. These are to improve access to primary healthcare, strengthen data collection and knowledge of RHD prevalence in endemic countries, ensure affordable and reliable access to technologies and medicines, to strengthen national and international cooperation, and to tackle the root determinants of RHD and rheumatic fever. Secondly, the resolution invites all stakeholders to collaborate with WHO and member states in order to put people living with RHD at the centre of the prevention and control agenda. It also makes 2 other recommendations, which are to raise the profile of people living with RHD and other NCDs of children and adolescents on the global health agenda. And secondly, to support and facilitate timely, affordable and reliable access to existing and new cost-effective medicines and technologies. It finally makes 5 requests to the Director General of the World Health Organization. The key request among these is to lead and coordinate global efforts to prevent and control RHD, and this includes a provision for RHD to be considered broadly across relevant WHO work areas, extending beyond just the NCD program. The resolution also requests the World Health Organization to support member states, to foster international partnerships, to monitor efforts for the prevention and control of RHD, and to report back on progress of the resolution's implementation to the 74th World Health Assembly, which will be held in 2021. Just to note, we also recorded a webinar on the resolution in March earlier this year. This webinar goes into more depth on this subject and also includes an interview with Lucy Richardson from the Government of New Zealand, the lead government in the resolution process. We'll include a link to this webinar below the video on our YouTube site if you would like to listen to this recording in more detail. That concludes the overview of items on this year's agenda. We'll now move on to side events and activities taking place alongside the World Health Assembly, starting with a WHO event, Walk the Talk, and for this I'll hand over to my colleague Mihaela.
Okay, thank you, Ali. So on Sunday, May 20th, which is the day before the start of the WHA, the World Health Organization is staging a major health promotion event in Geneva, which they're calling Walk the Talk, the Health for All Challenge. This will be a walk-run event open to everyone with 3 different route options, all starting and ending at Place des Nations, which is the main UN building in Geneva. The main aim of this event is to bring together WHA delegates, the UN family, non-state actors, and the Geneva community in a joint effort to promote health through physical activity. So we see this as a key opportunity to mobilize the cardiovascular community and raise awareness of heart disease. We'll have a stand on the Place des Nations, where we are planning a number of activities aimed at promoting heart health, and we've also set up a team. So if you go to the registration page, which we've included in this slide, you can sign up with the team name Heart Heroes. We will also be supporting the NCD Alliance Enough campaign on the day and promoting World No Tobacco Day, which my colleague Pilar will tell you more about in a minute. And if you're not in Geneva on the day, you can still participate by staging your own Walk the Talk event or by posting on social media using the hashtags Health for All and WHA71. That's it.
Thanks, and I'll pass over to Oana to talk about the second side event.
Thank you, Ali. Together with the Global Coalition for Circulatory Health, we are organizing a side event to raise the profile of circulatory health at the World Health Assembly. Entitled Positioning Circulatory Health in Universal Health Coverage, the event will take place at the Intercontinental Hotel in Geneva on Tuesday, the 22nd of May at midday, and will focus on hypertension. This is because hypertension is the biggest cause of preventable deaths worldwide and has a significant impact on health systems and economies alike. However, hypertension is also one of the most cost-effective and impactful conditions to treat. Therefore, we warmly invite you to join the Global Coalition for Circulatory Health and a diverse group of speakers and participants to learn how universal health coverage can be made to work for circulatory health and for people living with hypertension. Public health experts, government officials, health workers, and patients will unpack the reality of pursuing universal health coverage for circulatory health in diverse health systems and will provide real-life examples of managing and living with hypertension. I hope to see many of you there. Thank you.
Thanks, Oana. Our third and final side event that we will be participating in or co-organizing during the week is a side event on rheumatic fever and RHD entitled United to End RHD. This will be co-organized with our RHD Action partners REACH and the Medtronic Foundation, and is also co-sponsored by 4 governments: New Zealand, Australia, Fiji, and Namibia. This side event will focus on the impact of a resolution on rheumatic fever and RHD, on people living with RHD, and the frontline health workers who deliver essential RHD services. This side event will take place on the Wednesday, the 23rd of May in the evening at the Graduate Institute, and it will be moderated by Natalie Africa from the United Nations Foundation. And among the speakers that will be at the event are interviews with people living with RHD and frontline health workers from Nepal, Fiji, Zambia, and Uganda. The keynote speech will be from the Honourable Dr. David Clark, Minister of Health of New Zealand, and we're also delighted to welcome the Ministers of Health from Namibia, Bernard Haufiku, and from Fiji, Rosie Sophia Akbar, and also the Chief Medical Officer from Australia, Professor Brendan Murphy. This event will be followed by a reception, and if you are in Geneva and interested to attend, or any of the other events that we've mentioned, please get in touch via the email address at the end of the presentation. In terms of following the meeting, there are various ways you can do this. You can view all the meeting documents, the preliminary timetable, and an updated daily timetable online at the link that's on the slide. On the same page, shortly before the World Health Assembly, a link to follow the meeting via live stream in the 6 UN languages will be available shortly before the first session, so on Monday the 21st of May. You can also stay updated via our website, via Members News. We will be sending out updates and newsletters during the week itself, and also via the World Heart Federation Twitter feed. I'll now hand over to Pilar, who will speak about World No Tobacco Day.
Thank you, Ali. This year, the theme of the World No Tobacco Day is tobacco and cardiovascular disease. Tobacco breaks hearts. So the World No Tobacco Day 2018 will focus on the impact tobacco has on the cardiovascular health of people worldwide. So the materials that are being developed are posters, videos, web and social media collateral in the WHO languages. We will see an example on the next slide. A brochure with tobacco figures, fact sheets for the general public and health practitioners, a joint webinar with the FCA, which is the Framework Convention Alliance. It's, for those of you that are not familiar, it's a civil society alliance whose mission is to help develop and implement FCTC as a basis for effective global tobacco control. We will also have 2 press releases by the WHO and the FCA. And we will also have some heart hero stories, which are basically case studies with a picture and some quotes from professionals who are active in tobacco cessation activities. Some planned events on the week of the World No Tobacco Day. So this would be the 28th of May onwards. There will be an official event at the WHO on the World No Tobacco Day itself. This video that we spoke about previously will be on the public transport in Geneva, so on the buses and trams and others. And finally, there will be the FCA and WHF joint webinar. On the next slide, you will see one of the banners in English for the World No Tobacco Day, which is quite impactful. It's been done on purpose because it also follows a bit the packaging, the alarming packaging of tobacco, of cigarette packages. And also for those that are unable to read, it gives quite a clear message. Thank you.
Thanks, Pilar. And that's the end of the advocacy webinar on the World Health Assembly. As you can see at the bottom of this slide, there is the advocacy email address, and please don't hesitate to get in touch with any questions you have about any agenda items, side events, or World No Tobacco Day. Thank you.